is it 13? It's 2 o'clock. Edition.
13, this person, when I now saw it.
That's okay. Good morning. Oh.
Good morning. My dear, wait, make I mute myself.
Good morning, Mars.
Morning, my dear. Morning, Stella. Morning, Jemima. Morning, Margaret. Morning, Bobola.
Good morning, ma.
Good morning, ma.
Good morning, everybody.
Good morning, ma.
Good morning,
Yes,
everyone.
good morning.
Good morning, everyone.
Good
Yes,
morning, ma.
Good morning.
Hello.
Good morning.
Hello. Good morning. Madam MP. Good morning, ma'am. Hello? Okay.
Good morning. Thank you for the invitation. My name is Mr. Adibuki, not Adekola. Okay. The issue is that the genie is already out of.
Hello. Good morning, everyone.
Good
morning,
morning, ma.
Good morning, President.
Good morning.
You're welcome.
Thank you.
So we'll be starting shortly. Just wait for a few minutes, few more people to join us, and then we'll go ahead.
The analysis of the care and present danger CPA is able to identify how
Okay. Dr. Bole, I've sent you the presentation just in case I am not able to. I'll send it to your email. Can you just see if you can download it onto your system? Dr. Evo, do I send to you as well? Dr. Bole, are you hearing me? You're muted.
Yes, ma, I can hear you. I'm about to do that now.
I'm also sending it to Dr. Evo, just in
O-
case.
Okay, ma.
Until Coach Express. What that you're doing, it's on some of the island. As you know, it's free.
Dr. Bole, have you got it now?
No, ma, it hasn't come.
Dr. Bole, have you got the presentation?
It hasn't come.
I sent it to your email. Do I send it to your WhatsApp, then you forward to your email? Because it's taking time so that we're able to start.
Okay, sent, but
Once
straight
we have
to
the
email would
opening
have been.
prayer. I sent to your email. I don't know why it has not gotten there. That's why I'm saying open and forward to your email yourself. Just to forward to your email. Oh, what happened?
Good morning, my president.
Oh, my MP. How
Good
are
morning,
you?
my president.
How are you, MP?
Fine, thank you for the picture. Fine, thank
Okay.
you. This network is very, very bad, though.
He's finer than
Always
you. Oh.
in
I
and
know
out,
that
in and out.
his picture is finer than your own, MP.
Yes, so, you are right now. Maybe we are from different backgrounds.
Dr.
My
Bole,
children
it's not
fine
coming
past
through.
him now.
It's not coming through. It's still cute. I don't know why. And it's a very small PowerPoint, just 25 slides. So I don't know if you
Okay.
can use your WhatsApp.
Yes,
It's still
that's what
hanging. I
want
right.
to
So
do
I
that
think
now.
we can go and we can start off. I will start with
Yeah.
the presentation whenever you get
When I'm
it.
able
You
to
can
make sure it's there. Yes, ma'am.
some time. It's already 16 past. So
Okay, I have it.
oh, thank God. All right. So good
Let me
morning,
just
my elders, our past president. I can see Dr. Claribel Abam is there, and all our distinguished members who are here today. We are having the second edition of our monitoring and evaluation program, as well as economic empowerment of women for health. And this is part of our strategy to finish strong in the 2019-2021 biennium. And so we are going to start with an opening prayer, and we'll call on our immediate past national coordinator, Dr. Stella Wokocha, to give us the opening prayer. Dr. Stella, please unmute yourself.
Okay. Good morning, our esteemed M1 National President, Dr. Mini Moseji. Good morning, esteemed M1 members. Thank you very much for giving me this opportunity to take the opening prayer. Let us pray. In Jesus' name.
Amen.
Father, we thank you for giving us this opportunity as an association to discuss the programs and projects we have conducted in this biennium. We thank you for all you have enabled us to achieve so far. We thank you for all we are still going to achieve in the remaining part of this biennium. As we discuss today, we pray for divine guidance and leadership in every aspect of this program. We declare that our presenters communicate excellently well for all to understand, and we appreciate that the network of today will perform excellently well. There will be no disruption in our network from every of our presenters in the mighty name of Jesus.
Amen.
Find knowledge, wisdom for all our presenters, for them to have insights and resetting memory for all what they have prepared to give to us, and they give it to us excellently well in the mighty name of Jesus. Father, King of Glory, we declare that at the end of the program, this presentation, this monitoring and evaluation program we're having today, we have quality data that we use to move our association forward. We declare that as we have both the resources, all the resources we need, both human and capital, to carry out any project we have set our minds to do. We ask for strength for those piloting the affairs of this association in this regard. They are safe in their going out and coming out while carrying out this project. They have grace and favor in wherever they go to ask for help or anything they ask for. Grace follows them, favor follows them in the mighty name of Jesus. We also ask for enablement individually as members so that we'll have enough to contribute for our association. And at the end of it all, we all have cause to glorify your holy name. Thank you, King of Glory, for we know that you have answered us. In Jesus' mighty name we have prayed.
Amen.
Amen. Amen. Thank you so much for that powerful prayer. I will go ahead to my presentation. I seriously hope NC can share the slide. I'm having network issues on my laptop from my own end. And the title of my presentation is Monitoring and Evaluation of Health Programs, the February 2021 edition. The outline goes like this: objective, needs assessment, MWAN adopted health facilities, Worthy project, Edo State government challenge, sustainability of MWAN project, and then conclusion. So starting with the needs assessment, some of us have seen this needs assessment before. It is going to help us know where to put our advocacy effort. And we found that for the cancer screening centers for MWAN, we have a total of 9 in 4 geopolitical zones: Northwest Zamfara, Southeast Ebonyi, Enugu, South-South, Cross River, Delta River, Southwest, Lagos, Ogun, Oyo State. So this has been the situation since October 2020. We are hoping that by September 2021, we would have improved nationwide. Then for the presence of cryotherapy and thermoablation machines, we have a total of 5 in Benue, Kaduna, Zamfara, Ebonyi, and Cross River State. That's still very low. Then we are very happy to say that states with functioning health insurance schemes as at October 2020 were 16: FCT Plateau, Kaduna, Kano, Kebbi, Zamfara, Anambra, Ebonyi, Imo State, Bayelsa, Delta, Lagos, Ondo, Osun, and Oyo State. Please, kindly, one of the hosts should kindly be muting those people who are distracting us. Then for states that are implementing free maternal health program, we have 13 states: Akwa Ibom, Kaduna, Kebbi, Kano, Oyo, Yobe, Ondo, Sokoto, Borno, Lagos, Ogun, Jigawa, Delta states. For those implementing free under 5 healthcare program, all the same as for free maternal, except Borno State. So we have 12. Then for the state organizing regular maternal perinatal death audits, we have 20 out of the 25 states, we actually have 23. There's an error for Edo. The original data we got from Edo showed that Edo did not have, but later on, Edo sent us information that they had. Somehow in the preparation of the slides, that information was missed out. So if you present that slide, states organizing regular maternal and perinatal death audits and review, you have Imo will say non-regularly, Akwa Ibom, yes, Kaduna, not regularly, CRS, not regularly, and so on and so forth. But the most important thing is that the system is there. Now we had on the 1st of February, sent this information to the president of the Nigeria Medical Association, who was going to represent the medical community at the National Assembly, where they were going to present the National MPDSR bill. And he was very happy to receive this information, and he told us that he was sending information to the state governors as well as SOGON, so that they too can do something about it. So you will see why it's important to collect data for the purpose of advocacy and so on. Then for states providing emergency transport of pregnant women, neonates, and blood products, we have 10 states: Kaduna, Ebonyi, Kwara, Kebbi, Rivers, Lagos, Bayelsa, Osun, Jigawa, Delta states. Now I'm going to send Delta states emergency transport ambulance service was reactivated in 2018, August 31st to be specific. And we have a format. Every month, the Department of Medical Services and Training, they send me the the data, how many rescue missions they have had. And so I'm going to send you that format so that you can share it with your medical women in leadership positions, whether they are directly involved, so that they can advocate. That data alone tells us a lot about the quality of healthcare in our system. If we find out that they are rescuing, but they are delaying, there is a problem. If we find out that they are making calls for the emergency ambulance service and they are not responding, it's a problem. If we find out that they are just responding only to maybe victims that they are taking for one place or another for critical care, but they are not responding to the pregnant women who are in need, or neonates that need to be transported, there is a problem. So all that information can be made available if you regularly monitor that service. For us in Delta State, because I insist on getting that data every month, we have been able to strengthen. There were a lot of bottlenecks. So usually there are teaching problems, and gradually we are able to strengthen, and the service is becoming more efficient. Now, states implementing a blood transfusion service that is based on voluntary non-remunerated blood. And we have 12 states. We have Akwa Ibom, Kaduna, Kwara, Kebbi, Sokoto, Borno, Enugu, Lagos, Edo, Osun, Ogun, and the Delta states. Some said they have some, just the national, but we actually want state ownership. And again, for Delta State, our main area of voluntary non-remunerated blood is coordinated in the Delta State Teaching Hospital. We have a very passionate hematologist, Dr. Tina Okusere, who has been doing that. And if you go around to do sensitization in Del Sud, almost every other health worker will say they have donated blood. So MWAN is coming up with a campaign. Our National Financial Secretary, Dr. Ngozi Ali, is coordinating that. We're going to make e-flyers, and we're also going to provide stickers. We are going to make them available during the NEC meeting just before the national body hosts the regional congress, so that people will be encouraged, health workers will be encouraged to donate blood from time to time, even if it is just the health community, those people in our health facilities. It will make a big difference. And hopefully, as we become used to donating blood in a voluntary manner, we will be able to get other people outside the health facilities to donate. We also have coverage from the health insurance scheme, but that is not quite non-remunerated because there is some degree of payment for it. So we are trying to say we want people to be donating from time to time on a regular basis. Now, for the MWAN adopted health facilities pilot demonstration project, we will not go into as much detail as we did the last time. We are just going to give you some updates on that. And we are aware that we had 8 facilities, 8 states, Kaduna, Delta, Oyo, Kwara, Cross River State, Benue, Niger, and Zamfara in the initial phase. And we're happy to say 5 states joined, and then recently Kebbi State has joined. So we now have Akwa Ibom, Sokoto, Rivers, Imo, Lagos, and Kebbi states. Now, one of the outcomes, one of the expectations is for us to visit from time to time these facilities. And as God would have it, on the 11th of February, just 2 days ago, I had an opportunity to visit the facility in Delta State, which is Comprehensive Health Center Idumujiuno. And I met mothers who brought their children for immunization. And on close observation, I found a baby with cleft lip / palate in the facility. And then I asked her, have you planned for the surgery of your child? And she said, yes. I said, where? She said, Federal Medical Center, Asaba. And then I asked, how much did they say they will charge you? She said, 250,000. And I said, but this is what our MPS, the National Publicity Secretary, Dr. Wokocha, has been saying they provide free surgeries for through the Smile, is it Smile Train or Smile at Train organization, NGO. So I quickly got her details and sent to Dr. Vivian Omoagoja. And before I knew it, Vivian said she has contacted her and they booked appointment for next week. You can imagine my joy. I was really, really happy. And so we are all praying that everything will go smoothly. They'll be able to have the free surgery and they will use that money to train the child instead of spending that money on the surgery. So this is the benefit of visiting our communities. There's a lot of ignorance, there's a lot of suffering, there's a lot of poverty, and that's why we adopted these health facilities, because we can talk in our hotels when we are gathering and having meetings. We can travel to conferences and say fantastic things, but if we don't come back and translate it to the community so that the community can benefit, it's really going to leave a lot of room for improvement. So the observations still from the last time, we are still working on the findings on the adopted health facility. 12 cases of neonatal tetanus, 16 maternal deaths, 68 neonatal deaths. We've raised alarm about the high rates of neonatal tetanus in Zamfara to Federal Ministry of Health, National Primary Health Care Development Agency. We are still sourcing for chlorhexidine gel. We have appealed to up to 2 or 3 people to help us get it. And we're still not able to get health system strength, social mobilization for health, health data management, mental health, and essential newborn care, where we, as well as ICT, the essential newborn care, we emphasize on the use of chlorhexidine gel for cord care. Now, Delta State has the facility for Delta State has a low rate of family planning, and during the supervisory visit, I tried to find out why. And I was told that there is a lot of misconception in the community. So the next thing is to actually do a strong sensitization program. That's our next activity, because we've given them family planning flyers. They claim they are giving it, and yet the family planning is quite low. So for the Worthy project on cervical screening, our advocacy issues are still there, but I want to go to the next page, the one in red, to give us some results of our advocacy. The recent announcement by the Federal Ministry of Health that cancer care services are to be covered by the National Health Insurance Scheme. That shows that our advocacy is working. I know a lot of people say, oh, what is the effort? I mean, what is the result? We talk and talk and talk, nobody's listening. People are listening. The issue is you must be targeted in your advocacy. I know that I have sent messages to about 4 people in the National Assembly, Dr. Oloribe, Dr. Sununu, Honorable Osai, and Honorable Undudi Elumelu, 4 of them. And this morning, I sent them the news link where the Minister for Health said this is what is happening, to tell them that the advocacy is working. So what we are saying is that it's not just what you post on WhatsApp that is advocacy. You must be targeted. We've had several activities where MWAN was represented, and this is what we asked for. Clearly that we want the NHS to handle cancer, and we are happy. We're not saying we are the only ones that are advocating, but we know that we have made a loud voice on that. Then efforts to get Delta State Contributory Health Insurance Scheme to cover cancer is going on. At one of the board meetings, I presented this matter, and I was surprised. They said, if you put, please, I hope we are listening, because you need these tips for your own advocacy strategy. They said, if we put cancer as the diagnosis and they ask them to come and pay for cancer, they are not ready to pay. But if we put it under gynecological condition, that's cancer of the cervix, under general surgery, cancer of the breast, then even the screening is supposed to be put as gynecological investigation, then they will be able to cover it. So the next phase is for us to now interface with the providers to say, how can you present the cases like this so that it will be something that people can get coverage for. So that is our next stage. So what we are saying is that we need to engage with the stakeholders so that what we are asking for will actually come to pass. Now, details of the fundraising, next slide, will be given in a later presentation by Dr. Owa, the National Internal Auditor. But in a nutshell, we have since raised a total of 2,378,000 naira of our target of 7 million naira. We've expended 600,000 to support treatment of 3 cases of breast cancer and a case of cervical cancer, 380,000 for production of cervical screening flyers for 19 states. So the remaining 18 states, they will get their own flyers, cervical screening flyers at the next meeting. So if you know that you have not received your 20,000 for production of 500 cervical screening flyers, please make sure that you give the person who is coming for the next meeting, you give the contact to Dr. Agbonle, our national coordinator, so that the cervical screening flyers can be provided. We have also produced cervical screening flyers for 10,000 PHCs, and the states that have received their own during the NMA meeting include Abia, Adamawa, Akwa Ibom, Anambra, Bauchi, Bayelsa, Benue, Cross River, Delta, Ebonyi, Edo, Ekiti, FCT, Gombe, Imo, Taraba, Plateau, Rivers, Kaduna, Kano, Kogi, Ondo, Ogun, Sokoto, and Yobe. 25 states have received their flyers for their primary health centers. Now, when they receive these flyers, they're expected to go to the Primary Healthcare Development Agency and present those flyers so that they can share it amongst the LGAs. They have people that come for monthly meetings like local immunization officers, the medical officers of health, the malaria officers, and so on and so forth. So any of them can collect it, and these PHCs will get it. And I can assure you, even if it is only the females that are working in the PHCs that will see these flyers and understand what cervical screening is, MWAN would have made an impact. We have also spent 136,500 to support cervical screening for 278 women. We are aware that for the month of February, a lot of cervical screening is going on. Gombe, MWAN said they want to screen 3,000. And we are giving 500 because we are supporting the visual inspection with acetic acid and visual inspection with Lugos iodine components, which is very cheap. If you want to do pap smears, cytology alone may take up to 3,000. It is not sustainable. And as at the last time I asked Gombe how far, they said they've gotten up to 600, and a few other states have done, they are planning to do 1,000 and so on. So we are hoping that you will be able to send your reports of how many cases you have covered, how many cases you have screened, so that we can look and see, and then we can begin to make remuneration. So we are doing the remuneration in batches for a spread, but we're not going to wait for all the states forever. We have a limit. After a certain time, we'll just pay for as many states that have done until we get to our 6,000, and then we stop. So if you have not started, if you have started and you have not sent in your request for support from the national, then you will just be working in tangents with us. You will not be working as us. And if you don't request, we cannot add your data because it's the data that we have paid for. It's the ones we've paid for that we add. So if you look at the next slide, what we have reported to the worthy focal person, that is Dr. Uche Okwe, our National Assistant Secretary. We have for the Medical Women's Association of Nigeria, Enugu State, in their Medical Women's Center, they have done 205 women, and they've done 188 screening. We have already given them support for about 100. Then for Imo State, they have reached 82 and 50 at different times, and they have done cervical screening for about 82 people. Then for Kebbi State, they have done they've reached out to 74 people. They have not sent any reports on cervical screening. Then for River State, they have been able to do cervical screening for, they have created awareness for 50, is it 53? Yes, 53 and 23 at 2 different times. And then they've distributed 54 flyers, 23 flyers at 2 different events. And they have also done cervical screening. Then FCT has reached 100 females, 3 males, distributed 120 flyers, done cervical screening 90. And then we also have the Edo State, they have done 205 for awareness creation, distributed 50 flyers. They've done VIA for 137, and that were negative, 8 that were positive, 43 that were suspicious. Then for Delta State, they have done awareness creation at 2 different times. We have 54, 85, and 45. Sorry, we have for awareness creation 85, 86, and 54 flyers. Then the cervical screening 54 and 45. So that is what they have at different places. I know that they have a lot more, but because the report has not been properly submitted, this is what we have for now. So Edo State they were one of the first states to do their cervical screening after the launch. Unfortunately, I have asked them several times to send in their request for reimbursement or support. I do not know whether Edo State is here. Do they want us to, don't they want support from national? Is there anybody from Edo State that is here? So that is the situation we are facing. And well, I just want us to be up and doing. Now, the next slide is Edo State Government Challenge. If there's anybody from Edo State, please raise your hand so that we will ask you to pass on the information we are giving it to your state executive. Okay, I can see Dr. Antonia Njoku. Dr. Njoku, are you there? Please unmute and just let me know that you are hearing me. Or raise your hand. Dr. Njoku. Okay. I wish, Dr. Agbonle, can you use another? Okay. Please, I have a special message for you. Hello? Because your state government, you are hearing me, Nabi, Dr. Njoku. You've muted yourself again.
Hello?
Hello, are you hearing me?
Yes, I can hear you, Madam National President.
Okay, I have a special message for you, the Edo State Government Challenge. On the 8th of February 2021, we got a headline in the news, online news. Governor Obaseki decries corruption in state healthcare system. And he went on and all that. I was alarmed. I sent the message to Dr. Adesua, your state president, and my good friend, Dr. Iyasere, who is the CC board, Chief Consultant Board.
Yes.
And I wanted to know what medical women in leadership can be done by this challenge, because in addition to the fact that he complained about revenue being siphoned and so on, he also said that he could not get data. Now, Dr. Iyasere has sent me the response of ARD, and I sent her this response that it's hoped that medical women in leadership positions in Edo State will rise to the challenge of providing relevant data using the various capacity building programs organized by MWAN to refute the assertion that there are many doctors who are doing nothing. For your governor to say there are doctors in Benin doing nothing when he's only one doctor in which other place he calls.
Yes.
Go on. That's because data is not there. And he asked for the data to prove that those doctors in Benin are working. And unfortunately, the data was not there. So he just felt that nobody was doing anything. My sister, you see the beauty of data?
Yeah.
Yeah. So please, I
Hello,
want to
Madam
appeal.
National President.
Yes, I want to appeal to the
Oh.
medical women who have been participating in our programs. We've taught so much about data. You see how we are collecting data. You see how we are using our data for advocacy. Please find a way in the facility you're working, collect whatever your data is. And if it is possible, MWAN should send their own response to the governor to show that those doctors in Benin are working. Then the other aspect is that some of the residents can be sent on postings in the rural areas. In here in Asaba Federal Medical Center, the residents in community medicine, that's in public health departments, they go to communities. They have primary health centers that they go to for their rural posting, and they go there and work and participate in their activities. So it boosts the healthcare. Del Suits, they have taken General Hospital O'Hara and they go there and provide services because the patient load in Del Suits is not going to be able to meet up with the kind of exposure that residents need. So what we are saying is that even the federal government during the National Council on Health, they have indicated that residents should be sent to other hospitals and primary health centers to work under the supervision of consultants so that they can add. So for people, because they are doing residency, they have to be in the central hospital or the teaching hospital and they remain there. Meanwhile, there are so many other places where they could actually be helping out. It is very, very important. So this is our
Yes.
contribution.
Okay.
You can respond.
Like
You can
this
respond.
okay, thank you, Madam National President. Let me start with the last point. The rural posting, I think, is a prerequisite of all the colleges currently. And speaking about my own hospital, I know our O&G residents go to 3 different hospitals, including a hospital in Auchi, go to the General Hospital at Sabo, and they go to the Primary Healthcare Center at Tubiaja. Now, the community residents also, in fact, they have their own PHCs they manage, one at Usugbenu, one at, I'm talking about, my hospital is in Edo Central Senatorial District. The same thing also applies to Benin. But the thing is that the state government in itself is not even, like Central Hospital is supposed to be a tertiary institution offering residency program and all that, but they do not have enough. The NMA in the state, actually, apart from the ARD, is compiling a response with responses from its different affiliates, M1 inclusive. And I think they want to have a tete-a-tete with the governor. Now, also, my CMD a few weeks back told me that he had a discussion with the governor where, in fact, young fellows who have just finished, because we have kind of a backlog of some fellows who have finished, who have not been appointed. So he is trying to keep them in the system to see if the states, if they can work in some parts of the state, and that would reduce the bulk in the state. I think if they have that MOU, that would go a long way in helping. But like I said,
I didn't quite hear what you said about the MOU. So just send it as a chat so I can wrap up.
Okay.
All right.
Okay. Thank you.
So,
Thank
you. Thank
so
you very much.
We will continue to work on data. Like we are compiling on one that we're doing on cervical cancer screening and some other data. Luckily for my state, and that was what I told. That's why you saw I wanted to respond to that, what you said about Edo with the maternal surveillance. Now I'm part of a program in my hospital. I'm the PI, and so when the president talked about Edo, I said no, There's data from Edo. It's just that
Yes.
like we have this MPD for QED program, maternal perinatal database for quality, equity, and dignity program, which is a WH program. In Edo State, we have 3 hospitals that are part of that program. My hospital, IRA Specialist Teaching Hospital, University of Benin Teaching, and St. Philomena. So, and that data is really quite robust in the sense that you try to capture. It's a very big thing involving the medical records, the gynecologist, and the neonatologist. So it tries to capture all perinatal deaths that occur, maternal deaths that occur. In fact, yesterday my medical record brought 3 folders to me. So I think such things will help in various states. And I think also, yes, we are also part of the MPDSR. That's run by the Federal Ministry of Health. So the data is available. I think it's for us to synchronize this data and make a strong position to the governor. Because sometimes, you know, a lot of these programs are done. There are a lot of programs that are done. You know, like this program is run by WHO, this one is run by FMOH. So if you don't know, you just think you don't have data, but we have data.
Truly, you're correct. All right.
Thank you.
Thank you. Thank you so much for your contribution. I appreciate you, Dr. Njoku. So please share what we have said to your state president. So next slide, sustainability of MWAN projects. A lot of people have asked what will happen at the end of this biennium. And I say we have a sustainability plan and it is enshrined. Next slide, please, Dr. Agbonle. It is enshrined in the following strategies. 1, capacity building of state branches. Last year alone, we had 8 CMEs. Apart from the CMEs for which you need to pay to get your 5 CME points, those 8 CMEs had 5 CME points. We also have others in between that you may not have CME points, or you may have free CME points and so on and all that. We had a webinar for our pre-Congress, very, very robust. Then this year we have scheduled 3, and after that we will be done with our structured CMEs. We've had one, the second one is next Saturday, and then the third one will be in March. So all this capacity building is expected to translate in improved productivity. It's expected to translate in excellence, in increased administrative managerial capacity, in improved clinical, services. So that capacity, that building we have done in this structured manner, and many of our CMEs, like we said before, we have gotten because the ones on Zoom, we have put them on YouTube. The presentations, they are on the website, they can download them. So you can use them, refresh them, and use them to improve your work. And anytime they see a medical woman, an active medical woman working, they will know that, yes, she's an MWAN, active MWAN person. And when she's rising and accelerating in her career, there will be no surprise because of the investment we have made in our state branches. So this capacity building is a sustainable thing. We expect that every state will continue with whatever we have started. And also, we are also planning for a smooth and peaceful transition to the next executive. We know what efforts we've been making such that our transition to the next executive that will be based in Oyo State will be smooth. And by the grace of God, that would allow for more continuity. Then we are also having development and implementation of the second MWAN strategic plan. And that plan is going to be it was supposed to be 2020 to 2024, but because of so many distractions, we are planning that plan will be available before the next NEC meeting in March. So it will be 2021 to 2025. And so all these wonderful things that we have been able to do will be in the plan. And I was very happy when Benue State asked, do we have a plan? I said, yes, but I had to give her the old plan will help us sustain our projects. Now, publication is still part of our capacity building and is also part of the plan. We have activities that we are carrying out, and even this M&E that we are doing, we can actually publish some of our findings, like our worthy projects, all this data that we are getting from the states. We can do secondary analysis of anonymized data. We don't have names. Anybody who is to present them. So, and then we'll be able to publish them in peer-reviewed journals. So I want to specially thank the Ydf, because we've had so many committees. I don't want to mention them, but unfortunately, many of the research work and grant work and fundraising work we expected those committees to do were not forthcoming. But because I'm on the Ydf blog, from time to time I see their work and I know that they are really the pace setters now. And so I asked them, they should tell us those who have, next slide please, those who have submitted articles, published articles, done grant application and received grant awards. And these are their names. I will not bore you with calling them because I've run out of time. So just leave that slide for now so that people can see the names of those in Ydf that are really making MWAN proud. And for me, that is a big boost to our sustainability. So like I said last time, join the change train and recruit others, citizen participation, bring out the president, governor, and legislator in you, make change begin with you. That is the way forward for our nation. In order to improve the health indices of African nations like Nigeria, we must institute an efficient monitoring and evaluation system that involves all players in the health sector, using objectively verifiable indicators. Secondly, we must identify health workers who are doing well and motivate them financially and otherwise. Thirdly, we must identify health workers who persist in doing badly and sanction them appropriately. So, finishing strong, we'll continue with our virtual M&E programs till September, when we are planning to hand over. Thank you very much. We'll quickly go on to the next one, which is Dr. Agbonle. She's going to give us updates on the reports of
Hello.
Yes, Dr. Agbonle, you are the next on the program. Yes, so go ahead and give your presentation on the state reports. Thank you all for listening.
Thank you very much, Madam MP. Good morning, Madam MP, and all other protocol duly observed because of time. I'm going to present the M1 state reports for this biennium 2019 to 2021. Now, by way of introduction, the reports are from states as requested by the National Coordinator in preparation for the NEC meetings we've been having. We've had NEC meetings that have held physically and virtually 3 times since this biennium started on the 14th of September. And of course, we have all seen that COVID-19 has been a challenge, but we have surmounted it and we have embraced the new normal, which is virtual lifestyle, virtual meetings. And Dr. Oseji has encouraged us. A lot of states have done a lot of things, even physical things, but observing the COVID-19 protocols. The 3 meetings we've had, the first NEC was 5th to 7th of December 2019 in Abia State. The second NEC meeting was 14th to 15th of September in Abuja, and it was held physically and virtually, and that was because of the COVID-19 situation. That was the delay in time. We had 9 months interval. And then the third NEC meeting was virtual, totally virtual, on the 5th of December 2020. One of the things we asked the states to do was to make sure that they have deadlines to submit their reports, and they've also given guidelines. Sometimes we ask them to submit, with 1 page or probably allow them to do more than one page because we saw that the reports would expand beyond one page. And then finally, all the reports were put in spreadsheets summaries so that it will be easy for us to read and compare when necessary. So this is the first format that we sent out. It has been used over the years. We didn't change anything. We didn't add anything to this. And that was what was used for the first NEC meeting we had in Abia State. And the states that reported them were 7. 7 states reported: Cross Rivers, Ebonyi, Kaduna, Kano, Kogi, Kwara, and Rivers State. And looking at the reports, from what I could summarize, we focused on, please mute yourselves.
Dr. Alabileri.
So we found out that from the range of membership strength, Kogi had 12, Kano had 100. Other states also had in between, but this was the range. And then funds were sourced from dues, levies, and collaborations with NGOs, governments, and all that. Cancer screening activities were done in 5 out of the 7 states, as Cross Rivers, Ebonyi, Kogi, Kwara, and Rivers. And their activities included cervical, breast, and prostate cancer screening. And poor attendance was a general program. And meanwhile, 3 of the states had assets, as Cross Rivers, Kogi, and Rivers State had access. So if you look at this summary, I'm going to just go very quickly through. You find out that this is just the first NEC where you had only 7 states. So it was easy to put up, but you find out that I don't want to put up the rest because it's going to be too bulky. So we had a progression of the reports, of the coming, the submission of reports. The first meeting, there were 7. The second meeting, there were 19. And the third meeting, there were 23. Now, because of the size of those reports, I'm going to post them again. I know I've sent to the NEC members. All NEC members have received these reports by email. All. No one returned back to say it wasn't received. So please check your emails. But we'll post them on the pages so that we can see them again. Now, we found out that as our activities as M1 increased, the National Executive found it necessary to add other important aspects to our state reports that's before this September 2020 NEC. And those included the NMA activities, because with M1 members have been encouraged to be part of NMA and to bring the necessary change. We're talking about changes, we want differences. And the things that were important to do were transparency, walking the talk, and accountability. And we were not going to do these things out of, in the air, but we needed to be part of it. So NMA activities were requested. And in the first request was just to add NMA. We just put it on the page, please add NMA activities to reports. So a few states responded, but later we added it to the state reporting form. And one of the good, beautiful achievements was that on the 11th of December at the NMA NEC meeting in Oka, and an M1 caucus had their inaugural meeting with the national president of M1. Still on the progression of our reports, M1 Ydf activities, it's important to bring out our young doctors forums activities. They are the engine room of M1, and this triennium also focuses on the YDF. So we also must make sure that we are following that trend and making sure that they are part of a very, very important and strong part of M1. The M1 Senior Members Forum, this was inaugurated on Friday, 17th of July, 2020, and they are known as the M1 Senior Members Forum. They are members above the age of 60 years and above. And for now, I can safely say that Rivers and Enugu have done their inaugurations. I know I sent for a message, but I haven't received that message. This is a few of the MSMF members during their virtual inauguration on Friday, 17th of July. Now, this is the new form that we're using currently. I don't know if there'll be any other additions, but for now, this is what we're using. And if you can see we added the Ydf activities, we added senior member activities, and we added NMA activities. So these are the states that reported during just before the second NEC meeting, which held in Abuja. And there's 19 of them. I hope we're still seeing my slides.
Yes,
Hello?
we're seeing your slides.
Yes.
Seeing your
Slides.
slides.
Okay. All right, thank you. Thank you. Okay, so we have the list of them there. Let me not do that, because of time. I don't want to go through that. And this was one of the pictures that we took during the NEC meeting, which held physically and virtually. So these are the physical participants. Virtual participants, I don't have that one. So the reports, I'm going to try and summarize what we had. I want to try and summarize. So the range of membership strength is still from 12 to 250. Delta says we have 250. I'm waiting for that to be corrected because I know we have 250 people that, are members, but when it comes to capitation, I know it's not up to 250. So I'm waiting for that correction to be made, but that is what I was given. And I want it to remain as so until it is changed. Oops, sorry. The funds, most of the states, the funds are sourced from dues, levies, freewill donations, collaborations with state and government. And then the cancer screening activities held in 11 out of 19 states. And the screenings were for cervical and breast cancer screenings, sensitization programs, which included walks, health talks, radio and TV programs. And the states that actually held the activities include Akwa Ibom, Benue, Delta, Ebonyi, Enugu, Kogi, Kwara, Ondo, and Oyo and Rivers. So for the second NEC reports continued, poor attendance was still an issue with activities. And we had some states, that brought up particular issues like violence against members in the workplace by Anambra, lack of adequate equipment and building facilities. Lagos is the small well-woman's office space, Rivers, and 240 Dopplers out of the 3 received by Plateau. COVID-19 was a restriction, generally reported by everybody because most of the activities were planned to be physical, but they couldn't do that. And then on assets, 7 states that reported that they had assets. That was Akwa Ibom, Bayelsa, Cross Rivers, Enugu, Kwara, Lagos, Rivers. Ebonyi reported that they had started building and they were getting to the decking. Okay, the NMA activities also reported. This we had 9 states that reported. 12 members were elected. In fact, when I was going through, I was like, did NMA just give us 222 per state, or is it we that fought for the 222? That the states that they had 2 each, and then 2 states had 1. The 3 states had a position each. So you had states Anambra, AKS, Benue, Lagos, Ondo, and Rivers. Akwa Ibom State. Akwa Ibom. I had put it in the previous slide. Sorry about that. And then Ondo State brought up a beautiful plan, and they got the NMA chairperson. by name of Dr. Stella Adigbengi. And this picture is the picture of the NMA M1 caucus members in Oka, NMA Oka. Then I'm still continuing the second NEC reports for the 19 states. The states also had a lot of activities aside from these other things. They had dissemination of Lassa fever prevention information, COVID-19 resuscitation in various languages, hand sanitizers, hand mask distribution, red shoe collage, which almost all states participated, programs against illicit drug use, book reviews, activities against GBV, that's gender-based violence, protests over kidnapping, donations of IPC materials, #face mask challenge. Okay, # face mask challenge, gestational webinar, house officers orientations, fundraising for indigent cancer patients, baby prizes for breastfed babies, part of symposiums and also part of state COVID-19 teams. They also celebrated different days: World Glaucoma Day, World Neglected Tropical Diseases Day, World Oral Hygiene Day, International Celebration of the Girl Child, International Women's Day, 16 Days of Activism, World Cancer Day, Sickle Cell Day rather, World Breastfeeding Week, Father's Day, World Hepatitis Day, International Youth Day, World AIDS Day, World Menstrual Hygiene Day, World Blood Donor Day, and Children's Day. Note that I didn't arrange this in order of as they come in the year, but these are the different areas where our people, our states did programs. Now, these are the states. I'm going to the third NEC meeting now, the third set of reports. These are the states that reported. You notice we now had an increase. So all these states reported. And the range is still from 12 to 250, but we find out that more states reported now. So we have Kebbi, Kogi, Sokoto, and Zamfara reporting. They had 12, a membership strength of 12 each. And then Kwara increased their strength from 30 to 50. Most states' funds were still sourced from dues, levies, free will donations, and collaborations with governments and NGOs. And then we had some innovations of pap smear, clinical examinations, investigations, and pharmaceutical organizations, increasing the funds of Enugu State. And then Rivers had the M1 Diabetes Mellitus Conference with fees attached. That also gave them funds. The cancer screening activities were held in 14 out of 23 states. I'm going to give you the 14 states later, while 4 were to be held at a later date. It included cervical and breast cancer screening, still with sensitization programs. Delta State also received support from the National Secretariat to treat a case of breast cancer. By that time, she had taken 2 courses of chemotherapy. Poor attendance and participation was still a general problem of most states, and COVID-19 also was an issue of restriction. Kidnapping happened in Cross River State, inability to open an account in Imo State, and FMC Lokoja reported that they had been unable to, Kogi reported that because FMC Lokoja had been closed since July 2020, it had affected a lot of their plans. So these are the states that did activities just before the third leg. The assets were seen in AKS, which is Akwa Ibom State. They had land for a secretariat and a well woman clinic. And then CRS has landed property and a shop in UCTH, which is uncompleted. Ebonyi's building is now decked. Enugu, Osun, and River State have buildings and equipment. Anambra reported that they now had a website, and then NMA activities had occurred in 17 states, with 2 being elected in Anambra. The activities included attending the Physicians Week, SEC meetings, that should be State Executive Committee meetings. Yes. Chairs of members were put in made chairs of NMA state committees and participation in NMA courtesy visits, NMA visits to NYSC camps, NMA CMEs, please let's mute ourselves, and NMA sport activities. The YDF activities were in 23 states had functional YDF activities, while one was just inaugurated. Kebbi had just inaugurated this. They also had activities that included the heart and counseling of HIV positive youths, in the celebration of the International Day of the Girl Child, breast self-examination programs, collaboration with young lawyers, donations to old people's homes, recruitment of NYSC doctors and house officers, as well as participation in video clips produced by the YDF National. These are from different states. And concerning the MWAN Senior Members Forum activities, Rivers and Enugu had been inaugurated, while CRS and Imo were waiting inauguration. Kogi noted that they don't have members with this age bracket. And then Oyo and Ondo attended the virtual United Nations Older Persons event. All other 16 states had no reports. Please note that most states represented the MWAN, the National MWAN Secretariat at various programs. For example, I'm just putting examples because I couldn't put everything. The FIDA Akwa Ibom State Joint Task Force meeting against gender-based violence, Bayelsa State Primary Healthcare Board review meeting on maternal and child mortality, stakeholders meeting on statistics organized by government of Benue State, evening tributes in honor of late Senator Rose Oko, as at Cross River State, FIDA Ebonyi conference on fight to eliminate gender-based violence, NMA FCT NEC meeting, Deaf Women Allowed initiative, advocacy stakeholders meeting to curb medicalization of female genital mutilation and sanctioning of erring medical personnel in Imo State. The past webinar, assessing routine immunization funding, service uptake and coverage in Kano State, lighting of Emir Gwandu's Palace in Teal for the global elimination of cervical cancer, public hearing on Kwara State Violence Against Persons Prohibition Bill, that's this 2020, launching of the Oyo State Child Health Program, the Tomi Tia Initiative, and inauguration of Cervical Cancer Forum River State. All these states that I put here also had a lot of other programs that they also did. Thank you for listening. God bless you all. Thank you, ma'am.
Thank you very, very much, our amiable, energetic National Coordinator, Dr. Bobo Ola Agonle, for those details. We are actually supposed to take questions, but our guest speaker for the next session has come in.
Okay.
And that is Dr. Wokocha. You're welcome, ma. We are so delighted to have you. And please, can she be made a co-host while
Yes,
we
ma'am.
call upon Dr. Etie to give her introduction. Dr. Evo, please unmute yourself and introduce our guest speaker.
Good afternoon, Madam National President and the House. All protocols duly observed. We'd like to welcome our dear past National President, Dr. Wokocha. She is highly appropriate for the topic she was given today on financial literacy. Since the inception of this biennium, the National President, Madam Dr. Mrs. Oseji has been speaking about economic empowerment of medical women. I remember the first time Dr. Oseji put out a post of how much each medical woman should have and the specific age, especially in relation to health. And I was seeing millions at the age of 30, 35, 40. And I was wondering exactly how would medical women achieve this? However, I have seen that with various medical women, it has been possible. And we should not look at it that it's not impossible. Our past national president, Dr. Wokocha, MNI, who is the CEO of JCAN Travel and Tours, is here to tell us exactly how we can become financially literate today, so as to ensure that at the age of 35, 40, 45, 50, we can have millions in our accounts. So Dr. Wokocha, you are welcome.
Thank you. Thank you. Okay. Thank you. She has stopped sharing. Okay. Good morning over here. Can you see me? Can you hear me?
Yes, we can.
Yes, we can hear you.
Yes, we can.
Yes, we can. We can.
Just one moment. I am equally delighted indeed to be with my people. Yeah, just a moment. I'll be with you. I need to. Okay. Technical know-how, we are getting there, isn't it?
Yes, and it's helping, saving us a lot of traveling and a lot of logistics.
We'll be there. Can you see my screen, please?
Yes, we can, ma'am.
My screen visible to everyone, right?
Yes, we can, ma'am.
Okay.
Yes, we can.
Good morning. Over here, I know it's afternoon back in Nigeria, right?
Yes, ma'am.
My dear National President, your entire team, my colleagues who logged in.
Wow.
I love you all.
Sure.
My president talked to me and we were just sharing.
MBBS Germany, PhD, FGCOG, FWCA,
I am a passionate medical woman. I am a passionate medical doctor. I am a passionate mother of children and grandchildren. I'm a passionate wife. What I am about to go through with you today is just like discussion. You know, you scratch something at the surface because you begin to count one. When we have babies, they have to learn to sit and then crawl and then they stand and then they begin to walk. So this is just literacy. We want to empower ourselves with a bit of knowledge. You know who I am. I just put this here so that we can walk towards why we are here and what we are talking about. Most of you have known me all your lives as a gynecologist. That's correct. A certified psychotherapist is also correct. Some know me as being introduced as one of you. That's also correct. You know me that I do lift pilgrims to Israel. That is also correct. But you do not know me as a licensed financial agent. You don't know me. And that's why I am here. My quest for diversified portfolio has been from the very beginning when I became a young medical doctor in Germany. And that led me, when I came back to Nigeria newly, I spoke to the body of NMA about financially empowering the doctor. Let me digress a bit, because when I came home, your salary scales were so poor, I asked Professor Dorosimieti, give me a minute. What is going on here? He said, Ma, welcome to the club. I said, no, that cannot be. Those of you who can remember, if you do not know, NMA body knows how that we were at the, struggle with Ministry of Health to see that your salaries go up. That is just one stream of income. It wasn't funny. Sometimes they shut the electricity while we're on the 6th floor. We'll come down with phone as our light. But today you are having at least an improved salary scale. But that's not enough. I won't bore you with reading everything. I will give it to us because this is basics we want to talk about today. So what am I telling you? I am here to talk about literacy. Literacy in certain square is not going to school. You can go to school, be educated, but you are still an illiterate in some areas. So coming to finance, the medical professional has been a stark illiterate. We are doing better now than when I returned to Nigeria. This is true, but we are still far from being where we need to be. So what are we supposed to be doing? I want to interact with us this morning for you to understand what it is. It is the ability for you and I to effectively apply various financial skills. And what are these skills? These skills are personal financial management, your personal financial management, my personal financial management, budgeting, investing. Guess what? Financial management is not easy. As you start, you see certain things that will try to, distract, obstruct you from doing what you intend to do. But perseverance is the key. That does not apply only to you as medical doctors in Nigeria. It's a global thing. Millions of people till today, like I said, though educated, still struggle with financial literacy. Yeah, that is the lack of knowledge to make informed choices about your money. This weakness is most exposed when you see people wanting to transfer wealth between generations. Let me ask you, how many families are prepared to navigate the complexity of settling an estate? We are talking about widowhood right and all these things, inequalities and so on, family feud. When somebody passes away, maybe the breadwinner. How about the confidence and the skills that you have to meet? Is everything okay? Can I continue?
Yes, ma'am.
Yes, ma'am.
I'm sorry about that. So what I'm saying is, even if you have the desire to navigate these problems when they arise, settling your estate, do you have the confidence? Do you have the skills to meet up this demand, this challenge when they do arise? Because they will. We set into this world one day, we will also depart one day. So there are semantics that have to be, taken into consideration, learned and applied so that you can have a joyful stay while you lived and be able to do some transfer of wealth for your families. What is finance? Remember, I had told you that you have 3 types. One is your own individual, which is a personal financial management. Then there is the business, there is government. All of them speak the same language because they need funds to operate. But for the purpose of being here this morning and at our primordial stage, which is where we are, just enlightenment, literacy, we will focus on our personal finances. What does personal finance mean? It involves the analysis of your current financial position, the analysis of your current financial position. There is what is called FNA, financial needs analysis, to find out who you are financially, just like patients come to us and we find out how they are health-wise. Finance has this same methodology. It will then help you to formulate strategies for future needs within your own financial constraints. There are strategies that need to be looked at when doing that. And what are they? We look at your income, your earnings. We look at your living requirements. We look at your goals, and we look at your desires. Some of us don't even know that while we are young now, engaged, capable, that there will be a time when we will no longer be so capable. So when we look at all this, we're able to find out what you will do, how you will fare when you are no more capable. So what are these basic principles? I want you to pay attention to this guy. Pay attention, because this is you and I. This is every created. This is you and I. This is every created. One of the most important financial concepts you have to understand and live by is spending less than you make. Spending less than you make. If you fail to practice this basic principle, you will find it difficult to get ahead. You require making some initial life changes when you embark on this financial literacy and financial, disciplined practice. You will have to have some life changes. But the moment you start and keep steady, you will find it easy to continue.
Come and look for Ali. Come, did I make her?
We will also educate us on how you will analyze your financial habits, because that is what helps you. This guy, this is his income, and that is your pot. That's the bucket.
Okay.
It is from here that things begin to happen, which I will continue to explain to you, and you are free. I will wait for your questions. I'm excited because we are getting there. You have to make a budget for you to be financially literate and prudent in your practice of money management. You have to imbibe the culture of budgeting. You hear state governments, federal governments, nations have deficit. It's poor planning, poor budgeting. But as it happens in that larger sphere, it happens in your small quarter. Why then am I saying that it's important for us to budget? It is important for you to budget so that you can get a grip on your spending. It is important that you and I budget so that we can curb impulsive purchases. Do you know some people have that kind of habit? If they're not happy, they go and shop. It is important so that we find ways to cut costs. It is important so that you and I can be able to build emergency funds. You guys saw what began to happen globally as soon as the COVID-19 struck. Many places were shut down. Good earners lost jobs. Over here in the United States, you will see people you never would dream will be begging for food, queuing up in their jeeps, not poor man's car, waiting for handout. All over the 50 states, It is because of poor planning. It is because of lack of financial literacy. It is important so that it can help you set and prioritize your financial goals. It is important that you can start a savings program. The medical doctor in Nigeria, while I was there, I am glad things are beginning to get better. As I listened to this presentation today from our president, I can see that nearer and nearer draws the sea that must surely be an ocean one day, maybe not in our generation. But savings is a problem, still a problem. And the medical professional thinks first about anatomy and physiology. The highest thing is private practice, but that's not enough. And we will talk about that. Budgeting will help you distinguish between wants and needs. I'll tell you a story, my own story.
I'm told Anna.
I'm sorry, is it me? Hello?
No, ma, you can go on, ma. That wasn't to you.
Okay. I tell you my story. My father, blessed memory, had us 13 of us. He believed in the education of the girl child right from the onset. So when we come back from boarding schools, as you all did attend, in our time it was compulsory, except you went to commercial school. And it's about time for us to return back to the boarding school. Of course, you will require provisions and all whatnot. My dad will ask us to draw 3 lines, and we will draw, and he will ask us to write want. On line 1, we will write. On line 2, he says we should write needs, and we will do that. And then on line 3, he said we should write necessary. So if you say you want anything, go and sit and think what you want, in which of these 3 categories does it belong? Put it there, then you bring your list. Because he says what you want can be done without. What you need can be fitted depending on the situation and circumstances. But your necessary things, the necessity, the ones that are so necessary must be addressed. And the same is true today. That is how we imbibed the culture of looking before we spend in my family. I was telling you guys about retirement. Many of us have graduated as young ones now, are young medical doctors, young wives, young families with children, but you cannot remain young all through. And retirement planning is not when you are getting close to that time. It begins from the day you join employment or you become mature. And when you started that early, it then will not give you so much stress because it's a long journey, but you keep, like a tap that is dripping, dropping it into the bucket. I'm going to make this available, so let's keep rolling. You have seen that the world is evolving real fast. I wish its evolution is only for good. No, but it's the good, the bad, and the ugly. But we have to make do with it. In the field of finances, therefore, having multiple streams of income is a necessity. It's a practice that you and I cannot avoid in today's world. Are we okay? Are we okay? Can somebody mute? Are we okay? Are we okay? Are we okay? Hello?
Yes, ma'am.
I'm trying to unmute her.
Yeah, I think that's the best thing to unmute the person.
Okay. She's been, I think she's.
Please unmute yourself, ma. Dr. Wokocha, ma, please unmute yourself.
Am I unmuted? Can you hear me?
Yes, you are back.
Okay.
Yes, we can hear you, ma. Sorry about the interruption.
No, that's okay. But did we get as far as that retirement planning starts from day one, from the moment you join any employment? That means the moment you are engaged. This is an enlightenment crusade that we have to begin to, bring to the doorsteps of everyone. It's not only in Nigeria, that is what we are doing right now over here too, so as to minimize living below poverty level after working and earning well. But it's in our hands. Whatever we do is in our hands. So we have to start early, do it right, and then make sure that we are able to manage our assets. And I'm saying that one of the key measures, one of the key factors, one of the key practices to doing that is trying to identify sources of multiple stream of income. And that brings me to the next slide. In today's world, you and I cannot do without multiple streams of income. It's not just possible anymore. Things are so expensive. Inflation is way above the ceiling. So your one income cannot sustain you after you leave employment. That is at retirement. Not only at retirement, it cannot sustain you to have, the kind of lifestyle you would desire to have even now while you are working. So it is a necessity. It provides you a safety net. It creates financial security. Let's assume your regular income, regular job pays you X amount, and that takes care of your bills. The additional income will help you save more. It will help you invest more. It will help you to be the person you are today, the kind of lifestyle you live today when you have retired. This is what we're talking about. Gone are the days when men only went to work, women stayed at home. Those were good days. Now, even when both are working, it's not enough. Therefore, the culture of multiple income streams is a necessity. So, what is it that you need to do? You need to become literate yourself. Charity begins at home. You need to become literate yourself, and then you embark on this crusade. You see how we are embarking on the crusade of data collection, the other crusade, cervical cancer crusade that we started. It was MWAN that started it in the days, and many other crusades. This is a very important crusade because if you understand it, teach it, and it's being heeded. Even the projects that you are having in M1, I listened here where the president said that some of the things that you guys have initiated may not be continued. She mentioned, I think, the cost of cytology. That's just one. But if you and I embark on this crusade, we will save better, we will free more money, the masses will free more money. We can then use those money to donate back to organizations like yours so that we can attend to the needs of the people as they arise. The power is with you. I am not just saying all this to impress you all. No, I'm not. But it is to impress upon each and every one of us the necessity of building a solid financial house, the necessity of multiple streams of income, the necessity of diversification of portfolio in a world you and I know that is struggling with rising cost and inflation. Do you have children? Sure you do. Do we have families and children that we have sent to go to school? I'm going to give you a statistics at the very end, towards the end. What I'm talking to you about is not unique to MWAN. It's not unique to Nigeria. It's a global disease. Illiteracy, financial illiterates are moving, working, earning money, but they are not educated as to how money works. And without you understanding the dynamics of money, you will work and your money cannot work for you. You will retire and become poorer than you began. That should not be where we will land. It may be just the beginning of this enlightenment crusade for MWAN. I am ready to go into detail because that's what I do today. But this is just the prelim. We want to hear what it is, and we can take it next stage, so that you can benefit from the knowledge that by the grace of God, one is acquiring here that is helping change the lives of individuals and families. But while you have not known much, let me just mention one thing that people run away from. Do you know that nobody can save anything better than through life insurance? That's one, rule one. Those of you who have association with us here in the Americas, Britain, Germany, if you check your account, if you do have account here, for example, in America, Bank of America, Chase, Wells Fargo, these are big banks or corporations. If you have any dealing with them, you will find FDIC. FDIC. What does it mean? Federal Deposit Insurance Corporation. You and I have up till now known that we earn our salary, we put it in the bank. It is like when somebody is suffering from heart attack. It doesn't bring you anything. Your money does not grow. But we are teaching people now the mechanisms that have been in existence in this world. In America since 1913, still people, only 5% know about it and utilize it. So they imbibe these multiple streams of income and their money work for them in two ways. But we don't know that. It will not be for this very lecture today. I am ready to come back into more details so that you begin to get what it is, how you can then make these multiple streams of income, or how you can make your money to begin to work for you, and how you can plan so that you have a better retirement, even while the children are going to school now, so that everything is just not heavy load, but manageable. I will encourage you, please, to ask your children that are here, if they are in school, or your families that are over here, give them this very important wake-up call. They can call me. I left my number at the end. I wouldn't mind. It's not a bother. It's a joy if I can communicate with people so that they can be literate enough to take informed actions about their finances and their livelihood. Ask them whether they have ever had anything called family bank strategy. Some of you talk about the Rockefellers. What I'm talking to you about today, it is because of the level of their financial literacy that they are able to have generational wealth. Some of you have heard about the Vanderbilt. They did have wealth, but because of financial illiteracy, today, none of them is a millionaire. But the Rockefellers have gone 7 generations and are still going. That's a talk for another one. You know, it's when you have a child, you just can't start that day to feed the child with solid food. Today is milk. And I can come back. I will be delighted to assist my people with the knowledge God has helped me to acquire, and with the current profession work I am doing now, so that it can benefit people. It is not only applicable to the United States, it is applicable also back home, but you have to know how. Before I joined, I did not know how. I thought I had knowledge with all that I did, but guess what? I did not. I was working for my money. Yes, I was making them in diverse forms. Yes, I was living okay, but I did not know how that my money can work for me in the way that is coupled with joy and less distress. You ask your family members that are here, please do them that favor. Do they know what is called $1 million baby? Most of you here are young women with young children. Do you know how that you can raise these children both to university and then help them get married, help them settle without being in distress? Let them talk to me, I will assist. I had this crusade in August. I was bored during the pandemic because I am busy with my pilgrimage thing. Today in Israel, tomorrow in Nigeria, and then in America. That used to be my lifestyle. But when it all came to a halt, I didn't know what to do. I wasn't lacking money. That wasn't my own problem. My problem was boredom. I need and love to be among people. I love to communicate. I was able to have one-time community sensitization with my foundation here, but that was it. Again, you cannot gather. So what do I do? Boredom can lead to depression too, if you don't take time. I am glad they found me. They talked to me. I said, I need to register. My husband said to me, are you going to take exams? I said, yes, I will, whatever it takes. He said, you don't know anything about finance. I said, I will study. I will be going to their lectures and I will study and pass the exam. And to his glory, I studied and passed the exam. And the crusade is helping families, educate them stage by stage on how to manage themselves financially. Just like how to preventively manage patients to avoid their sicknesses or their complaints becoming, mature than if it is cancer metastasized. You don't want it. You want to nip it at the bud. So you call them for prevention. What are you preventing? You want to prevent progression to the negative. That is the same thing with your finances. We call them for prevention and we educate them on what to do. First of all, they must have their needs analysis. Remember, I mentioned it at the beginning, their financial needs analysis. And that is one of the things, Madam President, just like we are collecting this data for other things we're doing for other people, I would want to crave your indulgence, make our time before your tenure finishes. We will begin to apply the financial needs strategy to our own people. It's not good enough to educate somebody, but when you do somebody's needs analysis, financial needs analysis, the person will have it like a little Bible. You turn it and say, oh, this is where we are as a family, or I am as an individual, and I need to be here. Now, how do I get to that place? That is the bedrock of literacy, financial literacy. and I am open to assisting us, because without it, you cannot, effectively plan and enjoy your life. It is said that people plan to fail in life. You say, no, they don't plan to fail in life. They never plan to fail in life. But why do they fail? They fail because they lack effective and efficient planning. That's what it is. When you don't have it, definitely you fail. Look at, I just wanted to show you this statistic so that you get warmed up. It is not unique to you. It is not unique to Africa. It is a global problem. If the richest country in the world can be reporting this, and they are living in a society where they can do better, but because they are educated but financially blind and illiterate, then you can say, okay, let me see what to do, what we can start over there so that my people can become so exposed, enlightened, living better than we are doing right now. You can see these are not mine, these are not my words. That's why I left where I got this. 2/3 of American adults can pass a basic literacy test. They cannot pass simple, basic financial literacy test. It didn't say they didn't go to school. They did. But financially, they did not. And you don't need to go to school to become financially literate. That is the Fortune magazine. 44% of Americans don't have enough money, enough cash to cover $400 emergency fund. I tell you, today is just enlightenment. I will take these things, if we can make it regular training, when you have your trainings, I will join just to give us, even if it is one slide each time. I am ready. I want us to live better than we lived in our own days and the days before me. The majority of US adults, 61%, have had credit card debt in the past 12 months. And nearly 2 in 5, that is 38% of Americans, carry such debt from month to month. Nearly 4 out of every 5 US worker lives paycheck to paycheck. That is not different from you back home. This is true. Nearly 3 in 10 adults, 29%, are now saving more. I repeat, the COVID was an adversity, or is an adversity, but in the midst of adversity, something good is coming out. People, having lost what they thought was their niche, had to turn to multiple streams of income. This is true. If you don't take any other thing away from my relationship with you people this morning, please do take the fact that you don't have to be comfortable because of your job. You should sit down and ponder, what government is giving me, is it even enough compared to what I put in? That's one question for you. 2, if that income fails, how am I going to be living? 3, is it possible for me, even while I am with them doing their job, to do other things to augment? And if yes, what are the things? Because what you may want to do is not what I may want to do. But whatever be the case, you must live beyond depending on that paycheck to do other things. I was glad Madam President shared with me her plans, some of her plans in this field, in this regard. And I said, we need to, speak more to my people. Don't get comfortable with what you have now. 56% of American adults have less than 10,000 saved for retirement. I'm not joking. Some of you who have lived here will say 401k. I tell you today, we are on a crusade of taking people's 401k out of that vehicle. As my sister there, Dr. Oji, is driving, she will not want to drive a vehicle that is, that is unstable. Their 401k is put in a volatile market and they keep losing. That's why they should be retiring with only this. And you see nobody retires. They keep going back to employment. They keep going back to employment. They keep going back to part-time, whatever. Many of them retire and live way, way below poverty line, depending on Medicare, depending on Social Security, which is almost running out. I am giving you insight, and that is not far from you. Here, we will retire at home. We want to depend on our kids. You don't have to be a burden to them. You can retire better by imbibing the culture of multiple streams of income, of saving better. That brings me to the next slide. You see, you can have knowledge. Everybody can have knowledge, depending in which field you acquire the knowledge. But unless you apply that knowledge, it's useless. Knowledge not applied doesn't benefit anybody. Please, you acquire the knowledge, you take steps to apply it so that your outcome becomes better than your income. Start today, please. Start up. If you have not started, or if you have, please up your emergency fund. What is emergency fund? Each and every one of you must be sure that you budget, and out of the budget, that you know what you spend each month, the totality of your expenditure. If you are not able, as you are here on this Zoom meeting today, if you are not able to have saved 3 to 6 months of your income, just in case there is challenge, if you are not able to respond, which is what is found out during this pandemic here, people didn't care about emergency funding mechanism, saving for the rainy day, for the unpredictable challenges life brings in diverse ways. Again, I remind us that what we are doing today is just an awakening. We are trying to enlighten ourselves. That is phase 1. I will be ready to take my people to phase 2, to phase 3, so that you can be better, our children can be better. We depend less on government, depend less on a 9 to 5, do something that will benefit us and cause our monies to begin to work for us. Make sure you have the insurance you need. I don't know how many of us, if I should call for a research to obtain statistics of how many, though educated of us, have insurances. I don't even know what the insurance companies in Nigeria also do. Your money sits in the bank, for those of you who have properties and have sold and that put their money in the bank, is doing nothing for you because the bank turns around to take it to Security and Exchange so that they can have more interest while you get nothing. Sisters, there is so much to talk about. To talk about empowering ourselves. Have you seen a doctor being compared to, or maybe a politician or a top business somebody? You can't compare with them. Yet they don't have the knowledge you have. Yet they don't have, the power you have with your profession. But it does not translate to your purse. We have to change that culture. Multiple streams of income, better money management, spending less than you earn, even from the extra income making sure that you are saving. It's a habit, it's a culture that we must imbibe, and I am ready to work with you. You must strive to boost your retirement savings, even if it is just a little at a time. Remember, I mentioned about dripping, but by the time you know it, little drops of water, it becomes this pool. You must cancel recurring but unnecessary expenses. There are those who just, spontaneously spend. By the time we finish talking to you, enlightening you, you will be able to tailor-made whatever you do. It will be my joy, Madam President, if we can try to gather financial literacy statistics, just like we're doing this other data. That will help me honestly bring to the table the things that God, by His grace, is empowered me to doing. Have you ever known that your finance is like your house? The house I am in here, the house you are in wherever you are. That is how your finance is. This house that I'm living in now, it did not just stand immediately. They excavated, they started from the foundation. They made sure that there are costs, like the Bible will say, before you build a house, you must count the cost. They make sure they removed things that are going to be an impediment to completion. That is the same thing with your money. Money is a house. Money needs to be protected. Money needs to be managed. Money needs to be, to be watered so that your investment can be sustained. Guys, this is it. If you don't protect your money, if you don't solidly begin to learn some of these habits, you cannot have a solid house. By the time you are out of job, by the time you are 65 and above, you see that you're depending. Do you know what my pension is in Nigeria? 38,014 kobo. That's what my pension is. Imagine I am living on 38,014 kobo, even while I was working. But I didn't understand it that I was planning for my, exit then. So I crave your indulgence. Give me a call, talk to me, whatever, Madam President, you want me to do so that my people can get the next level, the second milk of building a solid financial house and acquisition of multiple streams of income and the habit of saving, of spending less and saving more so that they can have a brighter life and a fulfilled retirement. My hands are up. I will be there for us. Distinguished ladies and gentlemen, I know we have the press. I don't know whether we still do, but for my dear ladies, my senior colleagues, my younger colleagues, my esteemed national president, and your ESCO, everyone that has been working for the well-being of the people out there, because that's what MWAN does. Begin to think about your own well-being first, because charity begins at home. And again, put this at the back of your mind today, that your aim is when you don't leave them behind as families, when you don't leave yourself behind, when you begin to act right today, then there will be joy. Then you will impact society more. With that, I yield back the floor. I hope you did hear some of the things that I spoke on. I'm going to leave you with this, and I am open right now to answer your questions. Thank you very much.
Thank you, ma.
Wow.
Thank you, ma.
God bless you. God bless you, ma.
Thank you,
They know they listen. No, I don't talk tired. They don't listen.
I love my
Multiple stream of income is the new normal, is the way to go.
Yes,
Yeah.
Mama.
Tell them,
Yes.
I don't talk. They know 1 year.
Well done.
Thank you
very much. Thank you very much,
Ma.
We call
Thank
on
you very much, ma.
Dr. Vivian Omar.
Thank you very much, ma. I'm so grateful. Thank
I
you
hope
for the
una
great
go here.
lecture.
Oh, Jesus.
Thank you.
I
Hello.
hope una go here. Not be thank you very much. much now to take action.
Yes, so
Hello.
If you are tired of poverty, take action.
Good afternoon. Good afternoon, Madam President. Good afternoon, members of M1.
Please, everyone should
On
mute
behalf of
themselves.
Madam National President, I want to say a very big thank you to Wokocha for this great lecture she just delivered now on financial literacy. Ma, we are indeed very grateful for this lecture. And from the chat box, we have a question already from Dr. Agbonle. She wants to know the financial plan that is being used in the UK. Hello, ma. Can you hear me, ma? Hello, ma.
Yes, dear. Sorry. I was muted so that.
Okay, ma. Dr. Agbonle wants to know the financial plan that is being used in the UK.
In the UK?
Yes, ma.
You see, what I'm trying to give us here is the principles. Every country adopts or, takes the basic principles of financial literacy and fit it into their own culture. For example, in the UK, I lived once in the UK. I don't know what happens there today. I am talking from America, from the US. What is the plan? I have talked to you about when you have only one stream of income, it's like standing on one leg. And when that leg gets tired, guess what? You fall because you did not empower the other leg to also assist you to stand firm. That's one. And that is a global phenomenon. That has nothing to do with UK or this. Now, like here, I presume in the UK, what is their plan? There is retirement, which must be for everybody, okay? Now it is for her, or I can find out for her, what vehicles that government of the British government uses for their workers. Over here, that is to save. Over here, I told you everybody that has lived or is living here that is in employment, JOB, they push them to 401 and they say, I have 401k, but now people are waking up because even the convener, the founder of 401k for the state of this country, for the United States, he said, I created a monster. What makes it monstrous? 401k here, and that's same thing with Britain, and that is same thing with Germany, where I lived and worked, where I was trained. Your employer puts, in fact, they introduced it in 1999 when we started National Hospital. Contributory pension. Contributory pension. Do you understand? Your employer brings and you bring. You match, okay? My set was the first set when Obasanjo introduced contributory pension. And that made that people were no more given the huge sum that used to be given to them when they retire. Rather, it is distributed. They assume that you will live, you know what I'm saying? Live long so that you will be paid monthly. And in my case, I did not live long in Nigeria under government employment before I attained the mandatory retirement age and I left. So what happened? By the time they worked it, till now, any day they pay, on the 16th, I'm going to get 38,000. That's my money, 38,000, 14 kobo. I don't know, those of you that use cell phones, how long it could fetch you ordinary credit card, your scratch cards. The same thing happens here, but it's only the uninformed. That is what the crusade is all about. Yes, let the vehicle be, let them match what they have for you, but you don't go over them. Rather, you roll it over to a vehicle that is not volatile, that is not roller coaster. Like I said, this is just enlightenment. If I have opportunity of next time, we go to the next level, the vehicles, the rules of money and how it works, the rule of 72 introduced by Albert Einstein, the German, and how money grows, the vehicles that are available, and what vehicle could suit you, even with your small income, that it will grow. Where do the banks put their money? And if they do, banks don't die, why don't you put your money there? We tell you about how money is taxed. These are the things that bring you down. Do you even know how your paycheck is taxed? Do you know? Who can tell me what the tax is in Nigeria? What do they take deductibles? Do you know your salary just comes, you keep going? Why? Because you have no knowledge. But we will wake up to having that knowledge. We will wake up to knowing everything that happens with our finance. We will wake up to transferring our, our knowledge of money management to something.
Thank you, ma'am.
Better. Yes, ma'am.
Thank you very much, ma'am.
Thank you, ma'am.
Dr. Maureen also wants she wants to know what options we have, okay, to make more money without being involved in business or leaving our monies in the bank.
Very good. Okay. Like I said, I joined you people this morning when my president was talking about what you do, what MWAN has been doing for more than 40 years. But if you don't call your chicken a name, nobody knows it's your chicken. So with data collation and collection, we can say, hey, in this place, this is what this and that is. So coming to the financial, what we can do, how you can do without going into business. Do you know that business, well, if I may ask you, can you define business for me?
Buying and selling.
No, you see, that is why you have passed your MBBS, but you didn't pass this one. You know what I'm saying? Business, even your income that you make is buying and selling.
Selling, yeah.
Everything one does. And you have to manage your finance as if you were a business, as if you are a business yourself. What is your aim? If you are seeing yourself as a business, what is the aim of forming a business? It is to get better from where you started, isn't it?
Yes, ma'am.
The same way, we will educate you to know that the banks they love you when you dump your money, even in Nigeria. They love you. They call me here, 2 a.m. Mao is not ma nothing. It's because they have something that they can use to do their own bidding. But instead of it sitting there, I said we'll have a next level or at the biennial. We have to rise up to get to. Insurance is key. Insurance is key. Insurance is key, I repeat myself. And I have to delve into the Nigerian insurance vehicles to the government, because it's government regulated everywhere in the world, to know how viable your insurance vehicles are, because that is what both the government of this country, where they put their money, the treasury, is in, I told you, FDIC, that's government. Every bank, every corporation in the United States. Well, people, I will get to the next level because I can see the hunger. So yes, that seeing is believing. When you see that people that are better than you and I are putting their monies in vehicles that will bring more yield, then why do you dump yours in the bank, enriching the bank and impoverishing yourself? That's it. And that's why one of the last slides, I said, do you have even over here? Do you know before that your politicians, your government officials, you are both CBN and everywhere, they move their money to put in the vehicles here for security. It's not just any car insurance. No. There is the kind of insurance vehicle that you put your money, you must not be too rich. So don't think it's only for the affluent. Oh no, it's at every level. Even if rain is falling, it will not affect it. Even if divorce or lawsuit is coming, it will not affect it. No matter predators, it cannot affect it. Government cannot lay hand on it because that is the vehicle that has been in existence and where people go to hide. Do you know, for example, you're asking about vehicle. O.J. Simpson. You remember his story in those days, right? Maybe you don't.
Yes, ma'am. Yes, ma'am.
Very good. So he was rich, he was quite affluent, but he was informed. You see, this is the difference. He put huge, he kept on over years. This is not what you do in a day, so you don't think, what is my salary? How can I begin? We can begin it in Nigeria, but with your little mega salary. And you will not even know that you're dripping something there, but the interest is going high. Right now, as I talk to you, I am not in Nigeria, but hey, I sold a land in November and I put it in the vehicle. And I sit here every first to fourth, I get 9% interest. That is the life of the informed. I'm not there. I raise orphans, about 14 of them. I don't work there to feed them, but they are fed every day by the grace of God. Now, coming back to what I was telling you about here. So I want to, why did I digress? To let you know, it's not only what happens in America, it is in Nigeria. The only thing is that you have not found the vehicle and you are not informed. And we have begun a journey. Do you know that when he had his problem, government took everything he had, except that which he kept in that vehicle? I told you, government, tax, predators, lawsuit, divorce, nothing can affect anything in that very vehicle.
Thank you, ma'am.
So I yield the floor because there's so much. I mean, if you keep asking.
Thank you very much, ma'am. We really appreciate the knowledge that you're sharing with us this morning. Then Dr. Maureen also wants to know how you're able to combine managing your company with your clinical practice when you were still in service.
Very good. Thank you, Dr. Maureen. Let me go one step before that. I mentioned that I used to have a shop. I used to have a shop. When Emma Plaza, those who know Abuja started, who were the first people. You see, they were informed, they got money, they built complexes. I had a double complex. It's now secret, I'm leaking to you. You just have to plan your life. I will work from Monday through Thursday. Yours truly, this is among sisters now. Friday, I wasn't on duty. I wasn't on, it was my free day. I will finish operating on Thursday evening. My driver, my PA would have gone to check me in the good old days. Not today, nobody can check you. Even yourself, checking yourself is a problem today. So you see what I mean, that the world is evolving. Thursday evening, did you hear me? Check me in and I'll be the last to board. I remember one day I was bored and I saw a Jomo. Then we were no more in management. You know what I'm saying? So he was now my boss. He said, Big Sis, what are you doing? I said, Shegu, I'm just seeing somebody off. I made sure he entered and I was the last to board. He didn't know I was in the same aircraft. I flew into Italy. My first son is already waiting for me, flew into Italy too. We have the designers that we work with. We paid for our goods. Sunday, first flight. I flew back to Nigeria. By Monday, good morning. I sat in the office at the National Hospital. That is combination, that's combination number one. When I started the pilgrimage, I was as national head. And then they said, you are too old. Then I was even 50s. I remember one doctor, I remember his name. He said, how can they bring this old woman to be deputy head? But by the time, because of the grace of God upon my life, and he was heading, he's a young man, Fidelis is his name. I said to him, you are not doing this and that right, you're going to get into trouble. Guess what? At the end of his leadership that year, he said to the then blessed memory, Dr. Jackpo was then the chairman of the Christian Pilgrims. He said, I didn't know that this woman possessed this kind of thing. This woman, I said, I will give you all, you use it to work. We must not be at the helm of affairs to be effective. Get that into your brain, all of you. You must not be the leader to contribute effectively if it is genuine interest that you have. That's one. So the next year, they made me head, and I continued, and the Lord said to me, they are excluding people. Then they were excluding the elderly and the challenged, the physically and medically challenged. The Lord gave it a word, assisted pilgrimage. I went to the elders of the church, Dr. Ajakpo, Archbishop Makinde, Sunday Makinde. Then they prayed for me. They said, this is a tall Lord. I said, this is what the Lord told me. After they prayed, I started. What could I not do? Because I was in employment, what could I not do? My company was registered because I sought counsel also. You must seek advice. I'm not a lawyer, okay? But I am a financial professional, and the lawyer can only give you counsel. Your financial advisor can tell you to invest in stocks, invest in this, but your financial advisor cannot do what I'm doing for you. I am a professional that manages a human being financially from the cradle, 2 weeks old, to the grave. It's a big portfolio. And I'm glad and I'm happy. So what could I not do then? I could not register that company and be one of the directors because I was in employment of government. Wisdom has to be applied in whatever you do. Am I trying to leak some secrets? Because we are here as class.
Very interesting, Mark. Carry on.
Thank you, ma'am.
I got that counsel, and I followed the advice of the lawyers. So I began my movement and made sure that I was never found absent at my duty post. I would rather work more to take the free time to be engaged when the time comes for my pilgrimage activities. You can combine. Multitasking is the in thing today, and is the only thing that can help us. But you have to have a sound mind, focused when you are multitasking, so that you can multi-stream your income. Did I answer the person?
Yes, ma. Thank you very much, ma. We have another
Yes,
question
ma.
from Dr. Lawson.
That should be the last question. Last question.
Yes, the last
She has
question
her
from
contact.
Dr. Lawson, ma. Yes, ma. Dr. Lawson is asking, ma, that could you please shed more light on government bonds and treasury bills?
Exactly. Yes, I can.
Thank you, ma.
Yeah. You see, the government bonds and treasury bill.
I hope I can. Please.
The government bonds and treasury bills, they are also vehicles. But what I would want to make us understand is to be very vigilant. Know what interest you are getting from it. Because when you don't know, do you understand? It can be there. That's what I meant to tell people, that there are rules of money. Rules of money. The rule of 72, which is part of what she's asking now. The rule of 72 says that if I am, let's say, 29 years old, and you are 29, and another person is 29, and 29, we are all 29 years old, and I put my own money in vehicle 1, where I get maybe 1%. You put your own money in vehicle 2, where maybe you get 4%. Another person puts in vehicle 3, where they get 6 or 8%. Then another person puts in vehicle that gives them 12%. We have all put our monies the same day, we are age mates, the same amount. Did you get that?
Yes,
so when we come to check, what happens? Me that put my money in vehicle 1 with 1%, the rule of 72 says that that money is the same amount of money, the same amount, that amount of money will only double when I told you we are 29, 29, 29. It will only double for me in vehicle 1 with 1% when I am 101 years old. That's when that 10,000 becomes 20. That's first vehicle. Am I communicating?
Yes,
So
ma'am.
the bond and treasury that you are asking, Dr. Lawson, I want to know what they give you in interest. And one can find out whether you have a better growth. And then you can be advised. These are the things we do. We don't sell insurance specie, but we educate. When we finish educating you, just like she asked this, when we look at what you have or you don't have or you desire, then we can recommend you. My license in this country enables me to open my company in all the 50 states of America, in Canada as a country, in Puerto Rico. Not only that, this license that by the grace of God I got enables me to be free. I don't work for anybody. But I can, when she asked a question now, if a client asks me why I said, if you have families over here, please let them contact me. I left my phone number. I'm going to forward the distance. Let them contact me. If they contact me, or she's asking now, we look at what she has and what she's obtaining from it. If there's something better, we advise. Now, if she takes the advice, we are paid. Am I communicating?
Yes, ma'am.
So we don't go out. I don't work for any company. All the A-rated companies in this country that deal with insurance and money management, we work with them. I'm already enlisted with them. So, Dr. Funke, that is what we can talk privately. Okay? Next.
Okay, so I think that's all. That's all. Madam MP has asked that we that should be the
Please,
last
I
question
put
for
my question in the chat.
So there are questions in the chat,
Yes,
Dr.
there will
Wokocha.
be the questions in the chat will be can be responded to by chat, or we can later on meet our past presidents and get the response and forward, please.
Okay, yeah. So if they can, if another thing that can be done for
But
me.
we were not told.
Because of time, we are running out of time. So if you can repeat your question with your phone number and your email, so that we are sure that you will get your your
Let me share
answered.
real quickly.
Yes.
Let me. Okay.
Okay, so thank you, Ma. I think Dr. Onyiwa Owawambuzo now can go on with her presentation on the M1 Pink Donor Project, Madam President.
I don't know. Please, Ma, are you putting up a screen? Are you sharing a screen?
No, ma'am. I have stopped sharing.
Okay.
That's the practice.
Stop sharing. Okay. So you can put in the chat box your contacts.
Yeah, I'm
so
trying
that
to.
we'll also circulate it.
I'm trying to
send it in the chat box.
Okay.
So Dr. Owa, we want to welcome Dr. Owa, our National Internal Auditor. She is going to give us an update on our M1 Pink Donor Project. So Dr. Owa, please kindly share your slide. You have the floor. Thank you.
Thank you, Madam National President. Good afternoon, everyone. All protocols duly observed. Thank you, Madam NC. So I'll be talking on M1 Pink Donor Project. I know we are all very familiar with it. Please, can you put on slideshow, please?
Did I?
Please, can you put on slideshow?
Did I put slide?
No, no, she's talking
Thank you,
to
ma'am.
Dr. Bole, National Coordinator.
Oh, okay.
Okay, my next slide, please. I will just run through, just giving a brief overview, the objectives, the plan, participation, successes, challenges, and conclude. Examination, being that we now have a global strategy in place, MWAN has joined in that strategy. And with that, the Secretariat deemed it fit to constitute an 11-man committee to help in the Worthy Project for Cervical Cancer Project's launch in October 19, 2020. And the members are able National President, Dr. Oseji, Dr. Oseji, Dr. Agbonlea NC, Dr. Okwe, Dr. Evo, Dr. Nodin, Dr. Christy, Dr. Yetunde, Dr. Sandra Okekemba, Dr. Chiza, and Dr. Hamdala Adelaye. Next, please. So what is the objective of this committee? It's actually to raise funds for an expected outcome of screening 6,000 women and treat with cryotherapy for those eligible across the country. And our time frame is about 6 months. To also provide support and advocate the incorporation of cancer treatments in state and national health insurance schemes. This we know we have been trying to do in the various states. Next slide. So the plan for this to be achieved. Next slide, ma. Next slide, ma. To achieve this in over 6 months, we are encouraging states to try to screen at least 200 women over the period. You can take over 30 patients monthly to get this done. And I'm so proud that some states are already exceeding that target. And we are also going to try to increase sensitization, which we have been doing and advocating to relevant stakeholders like the Federal Ministry of Health and the Ministry of Women Affairs and some NGOs in particular. And we will also try to increase awareness, visibility of the burden of cervical cancer in various states of the country. This has been done with the help of our amiable national coordinator who has told us state reports on how this has fared so far. And we are also trying to seek collaboration with key stakeholders in the elimination of cancer, cervical cancer. Like for example, we had with the first ladies with areas of interest of cancer, that of Niger and Kebbi. So the journey so far, in increasing awareness, presentations have been made concerning palliative care and cost implications. This happened during one of our CME sessions. And we have established a collaboration with the Federal Ministry of Health in the fight against cancer. MWAN has been recognized also on her impact to society as regards cancer. And we have tried to organize a crowdfunding system to support treatment as well as advocate for incorporation of coverage in some states via social media platforms and even through social media influencers. We have also tried to incorporate promotional items like the face masks, t-shirts, and wristbands in a bid to enhance publicity of the initiative and funding to achieve our goals. Like if you watch, I am actually wearing 2 of the items here, the wristband and the t-shirt, which is very available in the Secretariat. Next slide. And we also have the Pink Donor book, which has been instituted also. So those are the promotional items there, the face masks, the t-shirts, all available to you. As little as 5,000 naira, you are able to help a woman to screen for cervical cancer, wherever she may be. So we are trying to encourage each and every one of us. We are so much on the platform. If everyone can pitch in to actually get a hold of any of our promotional items, we'll be solely encouraged and happy that we are trying to save lives here. Next slide, please. So far, you can see the gains from having just the promotional items. From the face masks we produced at the rate of 500 naira in 100 face masks. We sold at 1,000 naira, having a profit of 50,000 naira. And then wristbands at 500 naira, a quantity of 100, we have 1,000 naira being sold, and we have a profit of 50,000 naira there. The first batch of t-shirts were made at 1,700, 2 dozen at the rate of 3,000 naira with a profit of 31,200. The second batch of t-shirts were made at the rate of 1,300, 1 dozen, and sold at 3,000 naira with a profit of 20,400, with a grand total profit of 151,600. We can see that it's actually very low, but if all of us really truly can pitch in, we'll be able to make a huge difference in having funds to support our various states in the fight for cervical cancer. Next slide, please. That is the picture of the pink donor register. Donations have been coming in. We're so grateful to all various contributors. It is being updated every day for the purpose of posterity. Next slide, please. Now we have the social media pecs. I know you have been seeing them on our various platforms. With a little as 50,000 naira, we can make a poster for you to put on your various platforms to help us increase this awareness and sensitization. I know that the country is hard, but we know that as much as we can to help each other, it gives a great satisfaction to each and every one of us. So please let us be able to participate in one way or the other. Either you're buying promotional items as low as 5,000 naira, or you are going to give a generous donation for about 50,000 to get your e-posters ready, or even less than 50,000 naira. Whatever you deem fit in your mind to give to us, we will be so glad to receive it. Thank you. Next slide, please. So in summary, all the donations we had at the launch, October 19th, we had 1 million naira as pledges, and cash received was 490,000 naira with just 21 participants. And as of today, we have over 2.3 million from the 7 million that has been budgeted before for this program, with 72 participants and counting. We can see that we are happy that we are increasing more awareness, more participation. And so if we can have an increase in this, it would be beautiful. Summary of the states. So far in promotional items, Delta State is seen to be the highest in purchase of items. Abuja 1, Bayelsa 1, Cross River 2, Edo 1, Enugu 1, Kogi 5, Lagos 1, Oyo 1, with a grand total of 166,000 naira. At the launch, we had 12 participants who took up the promotional items, but as of today, we have 31 participants. We are so grateful to all those who have participated in one way or the other. So what has been our success is, yes, participation is increasing, lots of publicity on social media platforms since inception, and we have had collaborations with various NGOs in the strategy for elimination of cervical cancer. The Pink Donor Register, or the book, is already established and more names have been added. And as of today, 4 patients from different states are currently on treatment with MWAN support, one from Akwa Ibom, Bayelsa, Benue, and Delta State. Challenges so far: slow response from donors, and the use of social media influences has been seen to be very, very, very expensive. So not much activities is being utilized with the social media influencers because of the high rates of use. And then inadequate publicity by the state PROs of the various M1 states. As I said, I still plead that all the various PROs of M1 states should try to advertise or repost, do a post on their various platforms to increase awareness and encourage more members to this initiative. It will be worth your while. Next slide, please. And in conclusion, yes, the project has impacted positively. M1 is being recognized nationally. A lot needs to be done in terms of participation by members to help us achieve this goal. And we encourage states to commence their outreaches to achieve the mark, at least 200 women per state. It's very little, and we can even do more than that. And also, we will not hesitate to join hands to seek more collaborations from individuals and corporate bodies for this initiative. Thank you very much for listening.
Thank you very much, Dr. Owa, for that beautiful presentation. Somebody said River State, Dr. Koruba from River State purchased promotional materials and her name and River State was not added. So maybe you will make a
sorry,
review
we
of
will
the
update that.
and
Yes,
then we will
so
circulate. Sorry about the omission, ma. So I would like to call on National President-elect Dr. Tolorin to take questions on monitoring and evaluation of our health programs. Dr. Tolorin.
Thank you, my president and the House. Dr. Olushola Taiwo, my president, will handle it. Thank you. Dr. Olushola Taiwo, you are welcome.
Good afternoon, National President, the National President-elect, past President, and members present. Well, the questions on monitoring and evaluation, I wasn't able to get most of them, but I personally have a question, Ma. On an observation, when you were talking about the states that have screened and have had support from the from national, I want to say that Oyo State too got support from national for one of our cervical cancer screening outreaches for almost 100 participants. I don't think the national president noted that in our speech. And also, I want to also say that we've had collaboration also with other NGOs in Oyo State to screen about 900 participants for cervical cancer during the World Cancer Day commemoration. And Oyo M1 alone was one for screening about 300 of those participants. So just for the records, ma. Then also, okay, ma. Then also, the question, I didn't really get any other question for the monitoring and evaluation seminar.
Dr. Taiwo, there are some questions in the chat box, so you could take the questions.
Please, you can read them. Please, Dr. Estebwaje, if you can see them, because if you go in and out of
even
the chat,
from right now, some people just ask some questions now.
Yes, okay, but if you have those questions, help us repost them, because people who are fluctuating, who are having network fluctuation, they lose the chat.
Then there's a question from Aisha Mustafa that what is the criteria to benefit from M1 treatment? What is the criteria to benefit from M1 treatment?
Okay, I will answer that question.
Okay, ma'am.
The criteria is that your state will write request from the national that you have a case to give us details of the case, and then we will now make available the funding. Usually it is 100,000 maximum, but we need you to give us the cost of treatment, because the idea now is if we can pick it up early, those breast lumps that are small as groundnut seed or small as walnut, if they can, many of them just need lumpectomy. They don't even need mastectomy. And those ones will not even require too much money for treatment. So that is the hope. But by the time they start forming ulcers and you are thinking of mastectomy and all that, it becomes so expensive. So the idea is the 100,000 usually can take 2 cycles of chemotherapy. It can also take can contribute to surgery for those who need surgery. So that is the whole thing. So if you have a case, please, you make a request. Now, the approval for the request is subject to funding. We are budgeting about 2 million for treatment of 20 persons before we round up the project. So the question now is, it has to be available. So as the numbers are coming in and requests for treatment are coming in, we're also raising funds so that we'll be able to meet up with the treatment, with our contribution to the treatment. Thank you. Dr. Korubo's hand has been up. I don't know if it's for Dr. Uma Wokocha or for this one, but let her ask her question and let's see if we can answer it so that she can.
Dr. Korubo.
Sorry, dear. I don't have any question. I'm sure it's a mistake. Did you hear?
Okay, ma.
Hello?
Yes, ma.
I don't have any question. Okay, it has gone on.
Okay, ma. Now, another question from Dr. Esele says, it must be nice to know the list of states and the number of women screened per state for the WADI project.
We have indicated it. It's there in the
yes,
presentation.
I wanted to say that. Yes, I think it's been indicated.
So
yes.
what we know, people have done screening and they have posted, they just shared their pictures and some statistics. On what you need to send it to Dr. Okwe. Dr. Okwe is the coordinator, and you will, if it is health talk, you will indicate the date you gave the health talk, who gave the health talk, the phone number, how many people did you reach, how many flyers. So just posting it on WhatsApp, oh, M1 Delta or M1 Kwara has done so is not enough. There is a format, and we have said it as we present during my presentation. We even want to publish, and I'm reiterating, if you think you can help us work on getting ethical approval with NIREC, because it is what we are doing now is across the country. We need NIREC approval to publish, and it is just under secondary analysis of anonymized data. All this is data that is being collected. We can publish it to say, this is what M1 has done, and this is the impact. We are not using anybody's name, so the confidentiality is not a problem. So what we are asking now is that we need you to give us this information in this format. Please, M1 members, we are preparing you to be heads of facilities, leaders in the health sector. Look at Governor Obaseki saying he could not get health data in Edo. It's not that they are not working, it's that they have not put the data together. So why will you spend so much time? You will spend resources, you will print t-shirts, you will go to the community, you will go to a church, you will go to the health facility, you will screen, and then come back and just write the data and send to Dr. Okwe. Becomes a problem. We are begging. People are not answering. Ask, please, can somebody answer that question before we ask any other question? What is the reason why people are doing the screening and they are not submitting the data? Please, can somebody answer me the question? All right, nobody wants to answer. Maybe you want to.
I would think it's lack of awareness, ma.
We posted it again and again and again and again.
Ma, most people are used to just sending out pictures and not doing a data count, ma. It's what we have been used to over the years. So we're changing now, ma.
Yes,
exactly. That's what
All right, next question.
Okay, ma. The next question says, how many women among those screened per state were diagnosed of cervical cancer and had treatment using cryotherapy? This data will help donor participate and grant this data will help donor participation and grants approval.
Thank you very much. This question was asked by Dr. Ekwaze Etele. So please, Dr. Ekwaze Etele, send me the names of those donors. I will prepare that response and send it as a report to them. We actually planned to get a cryotherapy machine. In other places, they use thermal ablation. They say thermal ablation is easier or cheaper because you don't need to get the the ice or something like that. So the question now is we need to raise funds. By the time we got the budget to get one cryotherapy machine, it came to about 1.5 million. And the rate at which the fund was coming, we know we have a timeline for this project. It's not going to be there forever. The next tenure executive, they may want to do something similar. They may want to do something different. So we cannot guarantee it. When they come in, they will decide on what they want to do. So the situation now is we cannot now use the little fund, 2-point-something million, to just go and buy one cryotherapy machine. So what we actually planned was that when the COVID-19 subsides, we are now going to try and see if we can do zonal outreaches based on the cryotherapy machines that are already available in 5 states. So we'll go to a particular place and see if they can harvest the people that were positive and need cryotherapy. Ideally, it would have been nice you see and treat. As you see anyone that has a lesion, you just apply the cryotherapy. But as the fund for the cryotherapy is not there, that is the backup plan. So we hope that with time, we'll be able to plan for that. But for now, we don't have that as part of our 7 million. Because of that challenge of not getting the funds the way we were expecting, we just decided to limit it to screening, cervical screening, paying for cervical screening, then treating for cervical cancer, and then treating for breast cancer. You know, the two go together, so it's difficult. And right now, we've actually treated 3 cases of breast cancer and just 1 case of cervical cancer. So that's where we are with cryotherapy. Yes, Lagos, we know you have a cryotherapy machine, but your president, I saw it when I visited during Dr. Bakare's handover, but your current president, Dr. Sodenje, says whether it's not working or what. So if people can help us know whether it is functioning and so on, we can use it for the Southwest zone. Thank you very much. Any other question?
Yes, ma'am. I was trying to type it. Sorry, ma, just I've listened to what you people are just doing, and your last statement, and that's why I started raising my hand. Yes, your tenure is coming to an end very soon. That's correct. But that does not bring to an end the tenure of something that is good. That's why MWAN has not gone far. You see the stage you have taken it to? I plead with all of you, because by his grace, we all will come in to help you. Yes. I plead with us. It has to be a continuum. Even with next executive, another executive, it doesn't matter. It's not about the tenure of whoever is incumbent. It's about the good that you all are doing. And MWAN started this fight. Cancer. As a gynecologist, I'm very passionate. And I remember the teething problems. You know, we went to places and so on. Even the Minister of Health that is rejoicing today, it is what you did, MWAN. What we did that they used to come up with it. There was nothing there. So what I'm saying, I appreciate that we have not thrown cervical cancer care away completely. But please, I plead with the incoming. I plead with the association as a body. It is our baby. It's our baby. And please, I will chat you. You let me know the cost of therapeutic machines. Okay? Those are destinies. Okay? So that we can turn around and see, because the mission we are running here, what I'm doing, It's not to make money for myself alone. People are millionaires, billionaires, those who started, and depending how you run your race in what I'm doing currently. But we can get money because part of the commitment is that we have to empower the home front. And my home front first is MWAN.
Thank you, ma.
So please, ma, you and I can talk. I need to know cost and so on and so forth, and then that it has to be a continued program. Thank you, ma.
Thank you so much, ma. I will get that information across to you, and I've noted it. I will discuss with MPE concerning the continuity. Thank you so much, ma.
Bless you, ma.
Any other questions? It's 2 o'clock. We have been on this for 3 hours. We want to appreciate everyone. So we call on Dr. Okwe to give us the vote of thanks.
Just before that, my president,
yes,
I wish to thank you for giving us the opportunity to handle the questions and answers. Dr. Olushola Taiwo, thank you very much. Questions and answers are very important in seminars and webinars. It's a means of assessing how much understanding we have and how much we have acquired. The usefulness of the topic or the aptness of the topic at this season. Again, it is a link, just like in matters arising, and it is a pointer. Many people will remember the questions and how they were answered. They may not even know very much about the topic, but they will now go back to read everything in its entirety. So I wish to say a big thank you to everybody. Thank you, my president.
Okay, thank you. Dr. Okwe, can you just top up that vote of thanks? Unmute yourself.
Good afternoon, ma. Thank you very much, Madam National President. It's a considered opportunity and an honor and privilege to give this vote of thanks to everyone here. I wish to thank all members of MWAN who took out time to join in the virtual meeting of today. It is because we dream of taking MWAN to a higher level that we are all here. Thank you very much. My sincere gratitude goes to Dr. Wokocha for that beautiful lecture. And I particularly learned that multiple streams of income is highly important. It was highly insightful. And the lecture was well researched and well delivered. Thank you very much, ma'am. I must assure you that everyone on this platform really enjoyed it. I will also not wish to end this appreciation without remembering our national president, who has been at the driver's seat. And I know you will all agree with me that she is driving MWAN in the right direction, in spite of all the challenges of the 2020 and still ongoing challenges of COVID that is really present in our environment. But I equally wish that national president continues, and God blesses her for all that she's doing. I would like to thank everyone for being in attendance, and thank you very much for everything. God bless you all. Amen.
Thank you. The closing prayer is to be said by Dr. Ali. Dr. Ali, are you there?
I'm there, ma. Thank you, ma.
Okay, give us closing prayer.
Our national president, past president, Jesus' name.
Amen.
Father, we want to thank you for how you have led us in today's monetary evaluation of all our M1 project that you have used, our national president, Dr. Wokocha, Dr. Onyiwabuzo, and all that took every activity of today. Thank you for a successful day. Thank you for gathering us as sisters. Thank you for your grace. Thank you for moving M1 forward always. Father, we thank you for the wisdom that you have released for our national president. And we pray, oh Lord, that wisdom continues to grow from strength to strength. Amen. And as you use her to impact us, M1 can only be stronger in Jesus' name. Amen. We depart with your grace. We depart in your mercy. We depart in your peace. We depart in sisterhood love that will keep us together forever. This we ask in Jesus' name.
Amen.
Thank you so much.
Amen. Thank you, Madam MP.
Thank you
Madam
very
MP,
much.
thank you, ma'am.
To take focus who are keeping to their financial plan. If you have got your 2 million, you raise your hand. If you have gotten your 4 million, you raise your hand. If you have gotten your 10 million, you raise your hand.
But those monies don't necessarily need to be in our bank account.
We have started something, but it's not that much.
Let us keep trying. Let's keep trying.
Better to start than never.
National President, ma. National President, ma.
Yes, I'm here.
Money matter. Only on your videos, you might just get photos.
Thank you very much.
Thank you very much, ma'am. Okay.
I knew it was Vivian was busy making noise.
No, she's at it, but do I not see how fine she's looking?
Yes.
She's enjoying herself as
Olushola Taiwo.
How are you?
Fine.
Dr. Taiwo, ma.
Madam MP, ma. Well done, ma.
Thank you.
Well done, ma.
Dr. Ma, thank you for the work of big, deep knowledge. We have to use them. We just have to. If we're going to get somewhere, we have to use those words.
You know,
Thank you very much,
unless you want poverty.
Thank you, Mama Wokocha.
I was calculating my years to retirement. I was calculating them and saying, okay, how much do I now begin to gather each year? I didn't start it when I started work. I'm starting a late starter. So we have to organize it very well. Thank you so much, ma'am.
Go and do multiple stream of income.
We started. I started.
So COVID don't teach people sense.
Yes, better now than never.
Yes,
okay. And what we have to do, that can be a session, and that is the financial needs analysis. With that, financial needs analysis, when I do that for you guys, the template, you begin to run.
Yes.
Run your life. Everybody can, and we must.
Mama Wokocha, ma, Ydf is sending you a mail today, ma.
Okay.
Yes, ma. We're sending you a mail, ma.
Okay, darling.
All right, thank you, ma.
All right.
Okay.
Bye, everybody.
Bye.
Thank you, Mama. Love you.
Bye.
Bye, everyone. Thank you, ma.
Bye.
Bye. Thank you. My name is Baby.
Bye. I love you all.
Bye. Love you, ma.
Bye. Okay, cool. I will be.